This is Core Conversations with Natalie Baggio.
Welcome to Core Conversations with Natalie Baggio. Healthcare works best when our physicians are aligned with our community. So my guest today is Dr. Chris Harvey, Medical Director of Specialty and Primary Care here in Southwest Michigan. And I want him to share with our community how he accomplishes that through his leadership with our medical group. Welcome, Dr. Harvey.
Hello, Natalie. Good to be with you today.
Thank you for joining. Would you share with the community how long you have lived here in Southwest Michigan and what type of medicine you've practiced?
Yeah, definitely, Natalie. So I've been here for just about almost 21 years in July here. So just a little over 20 years. And I practice pediatrics down at our clinic in Niles.
Well, and I love that tenure. We're very lucky to have you practicing here for over 20 years and now helping lead future practices and future physicians into leadership roles.
Yes, it is exciting. I'm enjoying having both hats on. I enjoy caring for that patient day to day as well as the leadership portion of it as well.
What was one important improvement we've made recently that you'd want to share with the community or maybe they don't know about?
Yeah, now I think one important improvement we've made and something that's new and unique to our community is that we've actually brought a program to help support our physicians, specifically around the area of being able to have access for patients. You know, physicians, APPs, when they're seeing patients in our practices, they have a busy life. I mean, they are trying to care for that patient in front of them, but they have something called an inbox. And that inbox is basically like an email inbox that we might have. And so they're getting messages from patients requiring them, to kind of have a medication refill or ask a question. And so we find is that they're not able to answer those questions at the end of the day oftentimes. And so we have brought forth a program called an inboxologist. Mm-hmm. And what that is a physician assistant that's able to help care for those patients in more real time. They're able to answer those messages in that inbox. They're also able to prescribe medications and help on that physician's APP's behalf. And what that does is it takes that burden off of the physician APP, but also gets that patient more real-time care.
So what I love about hearing about inboxologist is it reduces the burnout for our providers, which in return increases their satisfaction and retention here in Southwest Michigan, but also allows our providers to see more patients in a day.
Yes, it does. It gives more access and opens their schedule for more patients.
And that's one of our number one priorities is to increase access to care here in Southwest Michigan. So what is a recent patient experience or a moment that reminded you of why your work matters so much as a physician leader?
Yeah, definitely, Natalie. I think one of the things that comes to mind is we had a patient who came into our office, an infant. That infant had a really high heart rate, which was unusual. And the thing that happened quickly is that nurse practitioner who was seeing the patient really noticed that was abnormal. And she used her skill set to identify that and get the team around the patient. And so she quickly alerted EMS and had them, kind of coming to the clinic to care for the patient, get them to the emergency room, but also stabilize that patient. And I think it really goes to show that her training, but also the team was able to help stabilize that infant and help take care of the patient in a way that was top notch and really saved that patient's life and got them to the higher level of care. And that patient, I'm happy to say, is doing well today.
That's really great. And such a unique experience by being a leader and still practicing. Yeah. And it keeps you really connected to the mission of the work and recognizing that everyone in healthcare has an impact on saving lives of people in our community every day.
Yeah, that is true, Natalie.
So what is one thing that you're most proud of in your work?
Yeah, I'm most proud of the support we're giving to our physicians and advanced practice providers. They are doing a hard job of caring for patients, and we want them to be able to do that well. One of the challenges is there's a lot of documentation burden for physicians and advanced practice providers in our practice. And so one of the innovations that we've been able to engage is with a program called a Bridge. It's an ambient AI technology. And what that does is it captures the visit so that physician, advanced practice provider could really just focus on the patient, take some of that mental burden of documentation off, but gets the accurate documentation into the chart. And so really that gives them the bandwidth to really provide excellent, exceptional medical care. And I think the more we can take care of physicians, APPs, the more that'll help them to take care of patients in a more effective way. So it really shows how technology is really advancing to help us care for our physicians, APPs, while we're caring for our patients.
Yeah, and I love that. And I actually had an opportunity to shadow a physician using a Bridge. Yeah. And I was really impressed with how it captured all of the patients' comments, concerns, and consolidated it to where a physician could ensure that they were meeting the needs of that patient in a very concise way. The advancement of technology, I think, is going to be really impactful for how we communicate with physicians and patients in the future.
Yeah, I agree. Yeah.
So what is a lesson you've learned over the last year?
Yeah, I think one lesson that I think all of us see, was something I'm certainly have been attuned to, is just the challenges and the complexity of healthcare. I mean, we're seeing just a lot. I mean, costs are increasing. We're having a difficult time recruiting people to care for patients just because we have such a need for team members. We're also seeing a lot of change in technology, new medications, new treatments. And I think that just makes it a complex system to work with. And so to that end, I think we have to look to who can help us solve these issues. And I think it really is kind of that team voice, both leadership, but also our frontline people, physicians, advanced practice providers, our team members, and even our patients. I think our patients have a lot to say how we can care for them well. And I think using all of those things together gets us to the right answer to how we can deal with the technology and all the other challenges that we're facing here too. So, yeah.
Yeah, and I love that we really take the feedback from our patients and transform that into change and new processes that in collection with our physicians and frontline team members that makes the biggest impact.
Absolutely.
Yeah. So in 20 seconds, what would you want to leave the community with?
Yeah, I think in 20 seconds, I think one important thing is that we are wanting to have access for all of our patients in primary care. So we are still building, but currently we have 14 different practices that allow our patients to have access to excellent, exceptional advanced practice providers and physicians. And so I would say that half of those practices are rural health clinics. They are in our communities serving our patients. We have one practice that's actually a home care practice that goes into the home. But really, these practices are designed to help care for those patients so that we're not just dealing with illness, but we're promoting health for all of our people in our community. And again, we're continuing to grow those resources there.
Yeah, and I appreciate your commitment to growing those resources. We hear from the community that we need more access to primary care, but you're building new clinics. You have openings in other areas of the area in Southwest Michigan that we haven't been able to experience in the past. So a lot of great work, but a lot more to come. So thank you again for joining me today and your leadership and your commitment to serving and practicing here in Southwest Michigan.
Yeah. Thank you, Natalie, for the opportunity. It's been great.
Thank you for joining us today on Core Conversations.